Hey, did you guys know that there's huge enrollment changes for those going on Medicare effective January 1st of 2024? Most seniors and people under 65 that qualify for Medicare are not aware of this huge change. Stick around, I'm going to explain it in just a second. So what is the major change that happened January 1st, 2024? Well, great news for you guys that are under 65 years of age that are qualifying for Medicare. You have an open enrollment period to allow you to enroll into a Medicare supplement that's 6 months, just like anybody that's 65 years of age and older. So if you're not aware how open enrollment periods work, or the initial enrollment period for Medicare beneficiaries is anyone that's 65, turning 65, if you don't have credible coverage or an employer plan that's going to have a continuation of coverage as you're working, you're eligible to qualify and enroll into Medicare Part A and Part B. Now, we do this 3 months prior, typically. The birth date month, if you're born on the 2nd all the way to the end of the month, then your birth date, your Part A and Part B effective date is going to be the first day of that month. Now, if you have a birthday that falls on the first day of the month, the subsequent month prior to, so if you're August the 1st birthday, your Part A and Part B effective date is going to be July. So you're going to back up 3 months prior to that. Or if you have a birthday that's August the 2nd, like mine's the 13th, you would have an August the 1st effective date. That means you would register for your Medicare 3 months prior to August, the month of or 3 months after. Now, that's for Medicare prescription drug plans to eliminate any kind of penalty, or Medicare Advantage plans. Now, Medicare gives Medicare supplement beneficiaries that qualify for Part A now, as of January 1st of 2024, if you're under the age of 65, you've been deemed disabled and go on SSDI, on the 25th month, you're going to be eligible for Medicare automatically. Well, now you have an open enrollment period as well for 6 months, just like somebody that's turning 65. So the only thing that you need to be aware of in this situation, and you need to make sure you don't do, it doesn't matter if you're 65 or you're under 65 when going on to Medicare, if you wait beyond the 3-month window after your birth date. So if my birth date is August the 13th and I go on Medicare A and B on August the 1st, I have August, September, October, November, December, January to enroll into a Medicare supplement, but you only have 3 months after your birth date month. So August, September, October, November is going to be the only 3 months I can enroll into a Part D drug plan without penalties. If I wait beyond that, I'm going to miss my enrollment penalty for the initial election period designed for Medicare Advantage or Medicare prescription drug plans. Medicare Advantage plans that have drug plans in them, or a drug plan. If you don't enroll in that 7-month window, you're going to have to wait to the open enrollment period, or like if you fall in an open enrollment period or the annual enrollment period, you would be able to enroll in October, November, December of any given year, and your plan goes into effect January 1st. So it's very important that you realize, even though they give you 6 months, you need to make the decision 3 months before, the month of, or 3 months after. If you're turning 65, or now as of January 1st of 2024, if you're eligible for Medicare due to your disability and you've been deemed with SSDI, that's Social Security Disability Insurance, you're going to be eligible automatically. They're going to put you on Medicare on that 25th month. At that point, you can enroll into a Medicare Advantage plan, which is a great option, or a Medicare supplement. Now, to end, I'm going to tell you the caveat of what you need to know about if you're under the age of 65 and you're looking to go on to Medicare and a Medicare supplement. The big cost disadvantage for you when it comes to a Medicare supplement, stick around and I'll be back in just a second. So if you are under the age of 65 and you're eligible for a Medicare supplement, you can go on to that as a guaranteed issue or an open enrollment option. So open enrollment means there's no underwriting for you when you become eligible for Medicare Part A and Part B, okay? A guaranteed issue is going to be like if you're past the age of 65 and you coming off of an employer-based plan and you go into Medicare for the first time, then you become eligible to enroll into a Medicare supplement, and there's not any underwriting question for that. Now, the caveat is, and when it comes to cost and what you need to be aware of, under 65 for Medicare supplements, you're going to pay almost double the premium, if not more, if you enroll into a Medicare supplement plan. Now, the only reason you would enroll into a Medicare supplement plan is access of care. Let's say if you live in an area and you're traveling outside to another state to get care from a specialist or a hospital. Typically, what we educate our members on that are eligible for SSDI and going on to Medicare under the age of 65 is usually we look at Medicare Advantage options, because it's going to have a zero premium. It's going to have a network of specialist hospitals and primary care doctors, but the cost to be on that in comparison to the premium it would cost to be on a Medicare supplement, if the Medicare supplement premium is $500 or $600 times 12, it's going to be equal or greater than the max out of pocket on the Medicare Advantage plan. The caveat is making sure your doctors, specialist hospital, your medications are covered by the plan that you need for a Medicare Advantage correctly. And then if you're in a rural area and you're accessing care all over the place, a Medicare supplement can be an option, but just weighing out the pros and cons when it comes to how much premium am I paying each year for a long period of time in comparison to a Medicare Advantage plan that has zero or very low premium, and then low copay costs that you pay up to your max out of pocket. So the max amount for that year, if it's $5,500, that's the max amount. If you have a premium of $500 plus a drug plan for another $50, you're gonna have $6,000 plus another $660 of Part D premium. And if you add that, it's gonna be more than the max out of pocket. So you need to do a little math. I would encourage you to get with a licensed agent or agency like us to allow us to walk you through your options. But the great news is prior to, some of these rules and regulations weren't in place. As of January 1st of 2024, they've updated some of the rules. And then here in just a second, I'm gonna update you on one last thing that's important to know. Stick around, I'll be back in just a second. So guys, instead of one thing, I'm gonna share with you two important things. One, I'm gonna read you a statement here. What about individuals under 65 who were enrolled in Medicare prior to January 1st, 2024? Well, there is a one-time 6-month Medicare supplement open enrollment for anyone currently on Medicare under 65 prior to January 1st, 2024. This open enrollment period began on January 1st, 2024 and will run through June the 30th of 2024. So guess what? I mean, we're past that time frame, but if you had a friend that realized this and you're like, I want to be able to do that too, but you didn't do that at that point, what can you do? Well, here's the reality. You're going to have to go through underwriting to be able to enroll into a Medicare supplement if you missed that window. They gave this open window, and honestly, it wasn't really educated among most broker agencies like us. Most people just didn't realize this new legislation was in place. But if you missed your window for your open enrollment effective January 1st, and you went on Medicare prior to, let's say you were on SSDI 10 years ago, and then as of January 1st, 2024, this legislation allowed you to qualify for a supplement within that 6-month window, and you've missed that, always reach out to a licensed professional like us to be able to find out what options you do have. The second thing is, will people under 65 receive traditional open enrollment period when they turn 65? So great news is, let's say you're 63 or 62 and you qualified for SSDI and you're on Medicare and you're trying to figure out what health plan option. Again, we can help you with that or deal with a licensed professional that knows what they're talking about. But the great news is, as you're turning 65, your open enrollment period for Medicare doesn't change. It gives you the eligibility when you turn 65 on your birth date month, on the first of that month, 3 months prior, the month of, and 3 months after, to still make options and selections and changes. Again, if you're looking for a Medicare supplement, you're going to have 6-month window, but you want to choose your Part D within that 7-month window. I like to tell people, always make your plan selection before your birthday month. So if it's August, again, 3 months prior, get all the ducks lined out so you know what you have going into your birthday month. If you need some education and some guidance through that, we'd love to be able to help you. Guys, you can click the link below. You can also register for one of our Medicare Made Simple on-demand workshops below. It has a guidebook, a complete deep dive into everything you need to know about Medicare, with me guiding you through and educating you on how Medicare works, all the different special election periods, all these different enrollment options, and going through and deep diving into the different health plan options, helping you, guide you towards making your life easy by making Medicare simple. Click below. We'll see you on the other side.